So what I'm here to talk about is how employee benefits has evolved, specifically with reference to health. Of course, we all, from the traditional way that we have been working out with, when we speak about how we started employee benefits, if you see what we're talking about is the GMC, the GPA, the insurance bit is always the tick mark that we give for our employees. Now, how do we evolve beyond this, right? We're looking at parental cover, we're looking at top-ups, and of course, parental cover is something very unique to the Indian environment. Outside in the Western countries, you will see that, parental cover is not so big, but of course, looking at our culture, how we take care of our parents, parental cover is very significant. And these are some of the elements that we surely are giving to the employees. What next? Things are changing, and I think that was emphasized enough during the earlier sessions also, that there is a lot of change that is happening in the workplace environment, and how do we adapt to that? How do we adapt that as CHROs, as the HR folk? What are other things that we are bringing in for the employee benefits? And this is where I think the next level comes in, where we're talking about your risk assessment, the health risk assessment for the employees. We're also talking about engagement elements of mental health, fitness, gym membership, and how do we keep them engaged? I think Sunil in the earlier session spoke about, there are a lot of gamifications, there is a lot of digitalization that is available. Are you utilizing this enough for your employees to be engaged with their health? Are you utilizing this enough to ensure that you're taking care of their health? And I don't mean that you handhold the employee for taking care of their health. Nobody can take care of anybody's health. You have to do it yourself. But are you enabling them? Are you giving them that access so that where your cost savings or where your performance comes into the picture is taken care of? What are the other elements that we are looking at in terms of employee benefits for health? We're looking at doctor consultations, we're looking at pharmacy, we're also looking at, your diagnostics, and of course, pharmacy vaccinations. Where does this element come into the picture? I'm sure all of you are going through this phase where you say that, I have a diverse population. I have a fresher who's joined into the system, and I also have a 40, 45-year-old plus who's taking care of their parents, who's taking care of their kids. How do I kind of give them a benefit that will help both the entire population, and it doesn't become very skewed towards a certain population? That's where your elements of bringing in a platform where everything, it could be your gym membership, which probably a 25-year-old, fresher would be enticed to, or it could be a challenge that you're talking about, a step challenge, as simple as a step challenge that would be enticed for a fresher. But you're also looking at your employees who are caregivers for their parents, caregivers for their family, for their spouse, for their children. And that's where you bring in the elements of, your doctor consults, your pharmacy, so that you're looking at the holistic care of the entire organization. And again, like I said, it's not skewed to certain population. Now, this is a little bit of, where we thought that what you should be looking at when you're looking at your health benefits. How do you evaluate your platform? I think right now, Nagesh, while in his closing remarks, made a very interesting statement where he said that we have to move towards digitalization. And it's available. Sarath mentioned a very important statement when one of you asked in terms of questions on performance. He said, we are at an era where there is support available in terms of technology to us. Why not use it? Why not use it for your benefit? Why not use it for your organization's benefit? So when you are moving your health well-being towards technology, what are the elements that we feel that you should look at? I think Neelu started with saying that, all of us have to be agile, not just in terms of organization, but also ourselves. I think one important aspect that you should look at your platform is flexibility and modular plans. And of course, this is in keeping in times of how diverse your population is. It cannot be a one benefit fits all. You have to look at various elements, and that's where your modularity, your flexible plans comes into the picture. You should also look at how your policies, the insurance policies or the benefits policies, are in terms of can you kind of give in riders, can you give up top-ups, so that that fits in the employee's requirement also. Along with that, also suits in your objectives of the organization. And one important element, we are at a phase where there's constant change, there is a constant newness that is available in the market. So how can I integrate with these systems into my platforms? How can I also integrate these services that I'm giving into my existing platforms? It could be your health, HRMS platforms, it could be your insurance platforms, so that you bring in everything at one place. And of course, we spoke about the user engagement and, how do I keep the employee engaged? When you're bringing in your health benefits platform, you're bringing in your benefits platform, you want the employee to be engaged, right? There is an objective for your entire program that you have developed and you want it to be executed. The important aspect of it is utilization. I know in my conversations with many of you, the first thing that comes up, I have this beautiful program that I have made, and I also have figured out what my outcomes are going to be. But if my employee is not going to take that step forward and use these services, how am I even looking at these outcomes? That's where you need to have that element where this engagement and the utilization can be helped with the platform that you have. And of course, in terms of how do I bring in the preventive care programs so that my cost at the end of the day is taken care of. And cost, I'm of course referring to the insurance cost that you will finally incur with your IPD claims. Now, 3 parts of the platform that you should be looking at, and I think that's where the whole industry is also moving towards, are your product, the network that you get from the platform, and of course the most important aspect is the outcomes. Now, in terms of product, we are talking about how the experience of the employee is. If the employee is not going to have a good experience, believe you me, they will not even go the next step after your login. So you have to ensure that you have a good experience that you're giving it to them so that they're enticed more towards using this. And I think the age-old mechanisms of reimbursements, right? We have been giving a lot of services to our employees in a reimbursement fashion. Why not move it towards cashless, which will also control your cost and which will also give a good experience to the employees. Look at the depth of the network so that every employee in every corner of the country is able to use these services. And of course, the advantage of cost that you will have with the defined network and the cashless network that you will have. Now, what I would want to talk a little bit more about is the outcomes. I think in the last conversation, they spoke a lot about data analytics. And I cannot emphasize more, and I think all of you also agree on how data is necessary for us to take any sort of decisions. Now, when you're giving a program for your employee benefits, of course, insurance data, end of the year, you will get to know what is the ICR, what is the claim, what were the kind of diseases that were there. How do I control these diseases? How do I ensure that these costs kind of come down and the program that I am giving in terms of the benefits, the health benefits, can I include those services which will help me bring that cost down? Will the program that I am giving now, will it give me that data? I'm sure all of you are doing some, maybe a little bit of elements of the employee benefits, could be your annual health checkup, or surely your mental well-being program. But are you getting that data, enough data to kind of take the next steps of how you could actually improve the employee's health? And employee health, like I said, it's not something of a benevolency that an organization should take. It's more of keeping into result that this will also impact the productivity as a whole in the organization. And that's where we need to ensure that whatever you're doing, you do infer from there, you do get that health outcomes, the analytics, and ensure that, okay, this is my analytics, these are the programs that I take up to reduce these diseases, to reduce these health, any kind of abnormalities. And end of the year, am I seeing those results that this is being useful, this has impacted my organizational health, and this is also reduced in terms of my claim cost. This is not going to come in like 3 months, 6 months, probably not even a year, but the consistency over a period of 2 years, you will surely see that impact. And you should be focusing on that. So I think in terms of summarizing what you should look at in a health tech platform, is of course in terms of how flexible your benefits are, how personal the platform can be. And it's a no-giver, right? You have to use technology now. That just helps you in terms of managing the health. It helps you in terms of providing that convenience and keeping the engagement going with all your employees, even if they are in some remote locations or if they are in metro locations as well. The health analytics that you will get from the technology, and of course providing a completely cashless network for your employees to use their doctor consultations, or it could be your ordering your medicines onto the platform. The cashless network, of course, brings in that cost element and a structured way of how you could sort of use these services as well. And making it easy for the employees to work on their OPD services, right? OPD elements that you have given, making it very easy for these employees to utilize these services. That brings to, what Visit Health does. Visit Health, of course, we are a health tech platform, and I think I've made some notes during our entire conversations, and we heard from Neelu. I said that she emphasized a lot on being agile. One of the things that Harindra also spoke about is adapting technology. Now, when you adapt technology, I think when Visit Health, what we are deriving at is providing a very agile system, covering us, benefits across the organizations, also bringing in that entire circle of how your engagement elements as well as your health is taken care of at a single place for all your employees, like your reward mechanisms and in incentivizing your employees for doing their taking care of their health, which is an irony, but yes, we have to do that. And of course, also in terms of providing your employees with a network which will help them in taking care of themselves as well as their family. While you give some space to a salesperson, they will definitely boast about the kind of clients that we have and whom we are servicing with all our technology and helping a lot of our clients in terms of taking care of their employees' health and working out on the cost reduction as well. So these are some of the clients that we work with, Oracle, Johnson & Johnson, Kohler, and I think some of you are also here, so we'll definitely would want to kind of hear from you that how your experience has been with us. Specifically to the programs that we of course have telemedicines and OPD benefits that are available onto our platform. You can also order medicines onto our platform in a very cashless way, giving you that restricted cashless network, which will kind of give you benefits in terms of cost. And of course, there is always this reimbursement element that is available, again, with a good adjudication available onto our system. One thing that I think a lot of you would be doing is annual health checkups, right? What next? You have the data of the employees. I think you've been doing it for a few years now. Have you even thought about, how can I get this data? What can I look at this data? How do I read this data? And can I give them something as a next step to manage their condition? It could be as simple as just managing the health the way they are, or it could be they are pre-diabetic and you would want to kind of give them programs. That's where your condition management programs comes into the picture, and need not be that every time the organization has to spend. It can also be how you nudge that employee towards that so that they can take that program up. And of course, the gamified wellness always is a winner, where even if we say that it'll entice your younger population, but it also encourages a lot of the elder population, I should not say elder, but yes, the mature population, who would be wanting to kind of participate in this, bring in that enthusiasm, and it always helps in terms of even your team building exercises. And I think enough was said about how do you enter the boardroom. Let Visit help you enter the boardroom with the data, with health analytics, and it'll not just be in terms of what costs you can save, but it can also be in terms of how we can improve your productivity, how we can help you decrease your costs with in your insurance claims, and how do we also help you with retention of employees when you bring in all your engagement elements along with employee benefits. Yeah, so I mean, this is something that you will get along with any of the services with Visit Health. And at Visit Health, we're trying to kind of work along with a lot of CHROs. We talk to all of them and build in a system that will help them and the organization, in terms of taking the next step for employee benefits.